We were told to come to the hospital at Tamik. Our youngest son had had a serious accident, and so we rushed in, and we were met at the door with the doctor of the morning, and he told us that they were going to immediately transfer Dave to Eastern Maine Medical, and that we would be very lucky if he made it there.
And there was a kid driving, he was from Bangor, 16 years old, and he was possibly going about 55 miles an hour. He came right straight in front of us and T-bowed.
I had an arterial venous malformation, burst in my upper right parietal. It caused a brain hemorrhage. It's a non-congenital birth defect. Basically, it was a capillary in my brain that had ruptured and caused a bleed, much like anybody else would have with a hemorrhage.
A doctor, he caused that because he didn't take in things. I think it was anesthesia shock.
I get in a car accident November 3rd, 1999. I don't remember it, but when I do remember waking up, I asked, what happened to me, and I know now that I sustained a head injury. My brain was diffused.
A lot of people didn't understand, like, I look normal. Just because I can drive, it doesn't mean I don't have an injury, which I do. It was hard for me to get my doctors to understand when I had pains in my head. They couldn't understand. Wasn't able to spit out my words like I wanted to.
It's very hard to look so normal, but not feel normal. And to not be angry at others for not recognizing when I'm struggling.
He was in a semi-coma. He was in a full coma for 30 days. And then for the next 8 months, he was in a semi-coma. It took Dave 3 years to learn to walk. We just noticed immediate changes in his talking. He first walked with a walker. When he started to walk, then gradually went to a quad cane and then to a regular stick cane. And each time he moved to a new location, he dropped one thing that was assisting him and went on to another thing.
I noticed I was in so much pain. My head had hurt it tremendously, and everybody kept saying I was different. I didn't realize I was different.
I had a house, a car, and possessions are gone because I couldn't speak.
I can be accepted into activities and environments as a person without a disability. But I suddenly realize I am disabled when that environment or that activity becomes more than I can handle. And then I have to get confronted with how am I now going to handle this situation or get out of this situation.
It has left me with residual paralysis in my left arm, my left leg. I have some work. I go to physical therapy 3 times a week. I go to occupational therapy 3 times a week to overcome the physical portion. I still do speech therapy to overcome the cognitive portions.
It slowed me down. It changed the way I think. I see the way I walk, talk, everything.
A brain injury is not just the person that's injured, it's the whole family. We all change. I mean, we all wonder what can we do to help this, if it's your sibling or your son, and it's not the same and never will be the same. It can't ever be the same when you have a brain injury.
They had a meeting when doctors were sitting around, and I was sitting in the main area with the doctors. They were discussing what to do with me. I couldn't speak, and they were things he was saying things like, you have to hook in a home, and I can understand every word they were saying, and nothing would stop them.
Can I muster the courage to ask for help? Can I let my pride go away and accept the part of me that's disabled and invite people into my world to help me? Or am I going to be very stubborn and suffer because I can't humble myself and ask for that help?
I was frustrated, I was angry, I was upset, confused. I didn't know which way to turn.
It took me over 5 years to get referred to some place that could help me, and realized that I did have brain injuries.
Every day is a challenging day. The things that we all take for granted, he struggles with. He's in a very strict routine, and if he gets out of his routine, it's frustrating for him because he can't remember where different things are.
I was just overwhelmed, and I just gave up. And it was pointless. How to tell them I am alive here? I can say nothing.
Right today, I'm about 2.5 years from my injury. So my biggest obstacle from recovery has been, I would say, physical limitations, but that's because I'm 2.5 years out. But I had vowed in the beginning, as long as I could get my brain portion back, and I could get so I could think clearly, communicate clearly, that I'd be happy and I'd accept the physical limitations.
It's hard for me to move on, make changes. I feel different. People look at me funny, weird, different. Makes me feel very uncomfortable.
To accept it, acceptance is the hardest thing in the world.
So I have to be very aware of what's going on with me. I don't know what the next surprise is going to be. But with each surprise I get, I'm challenged to look at it in a new way. Either feel sorry for myself or figure out what can I learn from this and how can I deal with it.
My goal for the future will be to get back to work, get back on my feet, hopefully to be in the public again, to live again, be happy again.
People that are injured, it depends on their personality and their perseverance, and so many things that go into that mix to make them excel in their recovery.
I wouldn't assume you have no mental faculties. They thought I was a 6-year-old because I cannot speak. I have, my brain is active. I can think and I can decipher things.
My goals for myself now are to try to get back to some of the familiar things I used to do.
Biggest help has been my family, definitely.
There's no question, I look at life much differently. I think with everyone, life speeds by. We don't have a time to honestly see the proverbial forest for the trees. We just remember there being trees there. And now, as this has gone on, I've had a much different outlook to really make good relationships, make things in life important. A lot of times we just don't see the important things.